The figures collected by Freedom of Information request by Luciana Berger, a Labour MP, reveal that ambulances received 30,000 more mental health calls in 2016-17. That's compared to 2 years earlier. Over the same period, paramedics spent an additional 55,000 hours supporting patients struggling with mental health. So what needs to be done to improve a system overwhelmed and struggling to cope? Rachel Kelly is an ambassador for the charity Rethink Mental Illness. She's in our Westminster studio. Rachel, many thanks for being with us. I have to say, I was rather taken aback by these figures. Were you as surprised?
I was surprised by quite how bad they were, though I did have a sense that this was the direction that we're heading in terms of the lack of support for mental health patients at the moment. I know that from my workshops, running workshops for Rethink and running workshops for Mind. We are facing a real crisis in terms of the number of people coming forward and the kind of help that they're getting.
So this reliance on ambulances, paramedic teams, using the 999 number, this is a direct result, in your mind, of the failure to provide enough mental health care, rather than, for example, others might argue, a significant increase in problems with mental health.
I think both points are true. We have a historic underfunding of mental health services in the NHS. For decades, mental health services have been the sort of Cinderella of the NHS, decades of underfunding. We've had a lot of talk about how mental health services need to have parity with physical health services. This was actually enshrined in law in 2012. But the reality hasn't happened yet, even though obviously now we have got government ministers coming forward and saying there will be increased funding. But just to give you a sense of it, in 2015, 2016, the respected King's Fund found that 40% of mental health trusts actually cut their budgets, had to cut their budgets. Mental health budgets are not treated in the same way as physical health budgets. So we do need a rethink of how we actually change the reality of mental health and physical health services truly having parity, less talk and actually more action.
2/5 of mental health trusts in 2015-16 experiencing a drop in funding. As you mentioned, the government are suggesting that they want to see parity between physical and mental health care provision. That's not going to happen anytime soon. So in the interim, isn't it better that someone who is experiencing some form of mental health issue is spoken to at the very least by a paramedic, a trained medical professional?
Yes, obviously, by the time you're dialing 999, you're in crisis. It might be a case of psychosis, it could be a case of self-harm, could be a drug situation. I mean, you're not going to ring 999 unless you're desperate. As you say, what do? You ring a paramedic. I mean, the thing about paramedics is that they're not that trained in mental health service provision. At the moment, they're mainly trained to deal with physical problems. I think this has got to change. I think it will be beginning to change. But people are desperate, and what do? I mean, there's the Samaritans. We saw last year a rise in the call. About 300,000 extra people called the Samaritans. That's about 5 million calls to the Samaritans. SANE, another charity I'm involved with, they also run a helpline. But I think that we're looking at it in a way the wrong end of the barrel. The fact that people are having to call 999 in this desperate state, we should be intervening far earlier. There's plenty of data that if you get to mental health problems early, you have much better outcomes. And so obviously we've got a situation where that kind of early intervention is not happening. Some of the lifestyle interventions that can make a difference, some of the community healthcare trusts, there's also a problem of sort of lack of joined up thinking between all the different providers of mental health services. So yes, you're right. Better to talk to a paramedic who is somebody on the end of the line than be on your own. But actually, I do think we need a rethink and just reconsidering that if we got mental health services right, so many other things would fall into place. We can't go on not realising quite how crucial mental health is to everything else. So, in fact, mental and physical health, in my view, are actually indissoluble. You have good mental health, you also have good physical health, and vice versa. Almost we shouldn't be talking about mental health, we should just be talking about health.
A good point on which to conclude. Rachel Kelly, Ambassador for Rethink Mental Illness. Many thanks for being with us.
My pleasure.